So now you can probably hear me better. If I get my, we might have to start this over. Okay. So I'll tell you a little bit about my story. So that's me and my wife up at some lake hiking somewhere. So this is my grandfather, my grandmother, call them granddad and granny. And this is where a lot of my concerns and my drive came from. So my grandfather, so I was about 9 years old when I left the city that he lived in. So I went to, he's in Texas and I went up to Ohio. And so we'd still come back every, and then we moved to Colorado. I'd come back at least once or twice a year and visit him. Came back one time, I was 9 years old, and he's in a nursing home. And they called him back then. And so I went in, and he looked pretty normal, the way I'd seen him before. And I'm sure I was briefed on how to handle this, but I did not know how to handle this. I came in, he's jovial, says, "Hi, who are you?" And this is my granddad. I was like, I'm thinking, what do you mean, who are you? I started crying. I left the room, and I don't remember seeing him again until I saw him in a casket, which was not that too much later after that. So he had Alzheimer's disease. This neurodegeneration, right? So I don't want that to happen to me. I don't want that to happen to anybody else. So I want to help prevent neurodegeneration. And then I had neuropathy that developed in my feet. I got some new orthotics, and I thought, well, these orthotics hurt, but on that foot especially. And I called the orthotic manufacturers, "Hey, what's wrong with this? These are uncomfortable." And they tried to help me out. They didn't know what was going on. But I discovered that I had neuropathy in my foot. And I'm like, what is this? I can't have this. I'm the one who's supposed to be helping me out. And I didn't know what to do for it. Now, if somebody had come to me, I would have said, yeah, I can probably slow that process down or maybe stop it. There's a lot we could do, but you can't reverse it. Nerves die. It's just, they don't come back. So, but now I know better and I've seen better. So that brings me here. And this has brought you here as well. Hey, it's working. Great. Okay. So a little more about me. So family chiropractor since 1996. So it's coming up almost 30 years. And my focus is on the nervous system and chronic health. So it's always been about that. Starting actually when I was in 8th grade, I wanted to help people become healthy, and I wanted to address as many aspects as possible, that synergistic effect. I didn't have those kind of words to speak with, but I knew that's what I wanted to do. Chiropractic neurologist, board certified since 2007. So what is a chiropractic neurologist? Well, if you said, well, what is a medical neurologist? So there's chiropractic and there's medical neurologists. Medical neurologist, we spoke about a little bit before, what do they give you? They give you medications, or they might be a surgeon, they might do surgery, and that's pretty much it. And if you want more, then they'll give you more medications or more surgery or different medications. Like, that's pretty much it. So if you're going to be a chiropractic neurologist who can't use medications or surgery, well, what do you do? Is there anything you can do? Well, there's a lot we can do. And so our focus is on restoring health and restoring function without using drugs or surgery. Certified in functional medicine. Functional medicine is the use of non-pathologic, which is disease, testing and treatment. So we look for deficiencies, toxicities, dysbiosis of the gut, leaky gut, immune deficiencies, and then we say, okay, how can we restore those functions through nutrition, through lifestyle, etc. And then lecturer and member of the Interdisciplinary Association of Functional Neurology and Rehabilitation. If you can say it 3 times fast, you get to join.
Wow, that's pretty impressive.
Okay. Basically, it's just a bunch of different practitioners getting together, and so how can we help restore nerve function naturally? All right, so the reason we get such amazing results in our office is because of something called salutogenesis. It's a different approach, basically. It comes from the Latin saluto, which is health, and genesis, the creation of. So it's the creation of health. And if I want to help you get healthy, I need to focus on factors that create health in your body and not those that create disease. Right? Because no amount of focusing on disease is ever going to teach you how to get healthy. Just like focusing on how to fall off a bicycle is never going to teach you how to stay on the bicycle. Right? So there's a place for both, but we really want to focus on health here. That's why we get different results. All right, so let's tell a story. I'm going to tell a few stories tonight, because we want to hear, does this stuff really work? Are there transformations? So this patient, she actually wrote 2 full pages of stuff. I'm just going to read you a little summary of it. So my name is Karen Hayes. I was diagnosed with peripheral neuropathy in 2011, but had symptoms long before that. I saw 2 neurologists. I started gabapentin in 2015 and moved to daily Lyrica in 2022. In 23, I had decompression surgery. That's where they cut the back part of the spine and open up spaces for the nerves. Right? It's supposed to be really helpful. After which my peripheral neuropathy became worse. I started tripping and occasionally falling on our staircase. I saw a peripheral neurology podiatrist specialist. So kind of a specialist of the foot neuropathy. It's like, this is perfect. If anybody's going to know, they're going to know what to do. But got no improvement. So at this point, she's scared and in pain. I started a thorough evaluation of Dr. Hobbs in October 2023. I do the daily spinal hygiene taught by Dr. Hobbs. It doesn't take very long, as enabled me to cut back on 3 hours a day of therapy as I was doing to lessen my neuropathy pain. She was doing 3 hours of therapy before she saw me. She was super dedicated. She had a bunch of little tools and equipment. She had half the stuff that I have in the office. And she was spending 3 hours a day trying to get well. And it was just getting worse. And so I see her, and I'm like, I hope I can get you better. Gosh, you're doing a lot. I don't, how much can we do? So we did labs, functional medicine lab tests. They were much more thorough than usual. I found nutritional deficiencies and bacterial overgrowth, explaining the years and years of digestion problems. I shared them with my physician, who was impressed. Today is day 20 of no Lyrica and no pain, even with 2 storms bringing in cold weather, which always sets my pain off. For me, this is a miracle. Also, I don't trip or fall anymore. So super cool. And now she's,
Karen.
that was a while ago now, so now she's still off Lyrica. All right, so the things I'm going to share with you tonight are not my opinion. If they're my opinion, I will make that clear. They come from research, reference, medical journals, and articles. So
that's a lot of reading.
It is a lot of reading, and I've got about 10 more research articles on my browser. Like, okay, there's just always more stuff to learn. Okay, so what is neuropathy? So it's damage, disease, or dysfunction of one or more nerves, especially in the peripheral nervous system. So the yellow adding all that blue, that's all peripheral nerves. So central is the brain and spinal cord. Everything else is peripheral. Right? Feels like burning or shooting pain, numbness, tingling, muscle weakness or atrophy, or impaired organ function. So you can even go to organs. And the cause, usually caused by injury, pressure, inflammation, infection, disease, drugs, toxins, or vitamin deficiency. And it's usually progressive, which just means it gets worse. All right, so there's some different types. There's peripheral neuropathy, autonomic neuropathy, focal, and cranial. Peripheral, we just talked about the peripheral nervous system, right? It's the damage of those nerves. Autonomic, that's to your organs. Focal, that's a single nerve. It's compressed usually. And cranial, that's nerves that come from inside the skull. There are 20 million people impacted by neuropathy, at least. This figure is significantly higher because not all people with symptoms of neuropathy are tested, and they don't go into a database necessarily, right? So the types of peripheral neuropathy, we talked about there being peripheral. You can have peripheral of one or many, and the many is usually autonomic also. So mononeuropathy, that's the one. You can have just one nerve that's affected. Damage to a single peripheral nerve. And that's often physical injury or repetitive strains that do that. So like carpal tunnel syndrome will do the median nerve, right? Tunnel of Guyot, which is over here, that will be the ulnar nerve. So there's specific nerves that can be compressed. Polyneuropathy, that's most cases are polyneuropathy. That's multiple peripheral nerves. That's usually in this, what we call a stocking and glove distribution. So like stockings, like socks and gloves. So it progresses usually in the feet first. That's the furthest from the longest nerve, farthest away from the cell bodies. So it's like you're putting on a sock, usually, and then both feet comes up, and then it starts to go into the hands. So that's that stocking and glove distribution, polyneuropathy. And diabetes is a common cause of it. Gluten sensitivity is a common cause of it. Nutritional deficiency. There's a bunch of things that contribute to it. And a lot of people we just don't know exactly what's causing it. We just try to make it better. Okay, so the peripheral nerves are like wires that send electricity to different parts of your house or connect your house to the internet. And when they malfunction, complex functions don't work right. So this is how it is in our body, but we can imagine it's like this in our nerves. And so you can have a loss of signal, inappropriate signaling, or interferences with distorted signaling. And that's what you feel in your, it's like either a numbness, it's like it's gone, I've lost that feeling, or I'm feeling tingling or like ants crawling up. That's a distortion or an extra feeling, an inappropriate signaling. Sometimes you have, it's like, well, there's nothing on my foot. Why am I feeling things? That's that inappropriate signaling. All right, so now this is a cool little graphic. We'll see how this works. I'll talk you through it. So central nervous system, that's the brain and the spinal cord. And nerves come up from the periphery, up the spinal cord to the brain. And that's where we perceive it. But this all happens on a really a cellular microscopic level where the one nerve connects to another nerve, and that everything has to be connected appropriately and has to be able to transmit that information along the nerve. You can have, these are chemical signals and electrical signals. Both of those have to be working right. And so the signals go down from the brain to the body to make things work, but then you get sensation that comes from the body up through the spinal cord and the brain. And the spinal cord is really key. It's not just a hole where those nerves travel up. There's also nerve receptors all around it. And so the brain is dependent on that proper reception from the spine as well as through the spine up to the brain. And so it happens from the feet as well as the hands. And it all ends up in the brain where we perceive either appropriate or inappropriate sensations. And it's protected by bone, the skull, and the spinal column. All those nerves travel into there and they're protected by it. And so we want to make sure that structure is working well, as well as the nervous system inside of it's working well. All right, we had that story. Okay, so we talked about some types of neuropathy, and then there's the stages of neuropathy. So stage one, and they don't always have to go in this order, but typically you have numbness and pain, then more regular or persistent symptoms, and then intense debilitating pain, and then constant numbness, and now you've lost that sensation, and then total loss of feeling in more areas. And it then reverses as the sensation starts to come back. I tell people, expect, if you're totally numb in an area, it may start to hurt, and we're going to celebrate that because you're starting to feel something, and that's great. Like, I'd rather not hurt. Yeah. But not feeling is really dangerous. That's when you can get cuts that develop infections, and then you can have amputations, and that still happens. So this shows you the different types of nerves, and they have different sizes, and they have different functions. So we talked about the autonomic, that's to the organs, right? So, but around every nerve, it's a single nerve is called a neuron. A nerve is actually a combination of neurons. So in a neuron, there's this inside and there's a coating. This is cut away. When they have these coatings, it's like a little insulation, right? And that helps the nerves travel more efficiently, quickly at insulation. If you lose some of that insulation because of an autoimmunity or deficiency or toxicity, then those nerves can start to misfire. Okay, so damage to nerve dysfunction loss occurs from smallest to largest, typically. So autonomic is lost first. This makes your heart, blood pressure, sweat, gut, intestines, and sexual function work. And then warm, hot, burning, and pain. Pain, we can always sense pain. Our body's really efficient at sensing pain. So even if we lose the sensation ability to perceive pain, our brain will default back to that and say, hey, you probably should be feeling pain, and it'll help you to perceive it so you do something about it. Even though if somebody stuck you with a needle, you might not feel it. You go, no, that doesn't hurt. But then you might spontaneously hurt when you try to sleep at night because the brain wants to bring your attention to that area so you'll do something about it. The key is knowing what to do about it. Okay, so then we have cold, touch, vibration, and then muscles. So weakness usually comes last. So if there's weakness, then we're really concerned because things have gone a long ways. All right, sensory nerves. The function is to transmit information, feeling, light, touch, temperature, pain, back to the brain. Symptoms include either an increase or a decrease of those. Right? So motor nerves, it's a movement of muscles, and then symptoms are basically an increase or decrease. You get cramping is an increase, or weakness is a decrease of that function. All right, so this is another way to describe the stages, what peripheral neuropathy feels like. I think this is a really good example. Sometimes you feel all those at once, or sometimes just some of them. Numbness, prickling, or tingling in the toes or fingers, then burning, freezing, throbbing, or shooting pain. Weakness, numbness, loss of feedback to the brain from the numb area. And like I said, just because you have lack of feedback, you have numbness doesn't mean you don't perceive it, even though you can't feel it. That's the worst. Finally, the numbness makes you unaware of cuts and nicks that lead to ulcers and amputations of toes. We always have the option of doing what we have been doing, but if your condition has worsened to the point it is now, what will keep it from continuing? Even with conventional medical wound care, which I strongly encourage, the options become limited. So we use what's called a monofilament. It's like a little fishing wire, when there's different strengths of them, and we touch your foot and hands with that, and you tell us if you can feel it or not. And that's how we can quantify the degree of loss of sensation. If you get to 10, which there is more than 10, but 10 is a threshold at that point, and that's what podiatrists typically use. If a doctor uses 1, they'll use that 10. If you can't feel that, then you're in the danger zone. Then your probability of getting a cut that you don't feel or getting an infection you don't feel is really high, and so you have to observe your foot every day to make sure it's okay. And if it starts to get infected, you already have diminished blood flow, and so your probability of healing is lower. So you have to be careful. All right, autonomic nerves. Remember we talked about those as to the organs, right? So we'll go through that in a minute. This is sympathetic and parasympathetic. Controls organs to regulate activities that people do not control consciously, like breathing and digesting food. They can have a wide and long-lasting impact on organ and overall health and well-being, and this is the most overlooked and misdiagnosed form. So this is your vagus nerve. Cranial nerve 10 comes from inside your skull, and it communicates down, and it impacts most organs. You also have a small section from the sacral area that comes up, and it's parasympathetic also. But yeah, your heart, your lungs, your intestines, all that's impacted by your parasympathetic nervous system. And if it's working well, then your body is healing well and it's adapting to stress as well. If it's not working well, then it's hard to recover from stresses, physical, chemical, or mental stresses. All right, so we have the parasympathetic and sympathetic, but a better way to think about it is the resting, digesting, and repair. And this is fight, flight, or freeze. Now we need to be able to do both, but we do this. We spend a lot of time here. Right? That's just how society is. We have unnaturally stressful environment, physically, chemically, and mentally, and so we do a lot of this. Dilated pupils, inhibited salivation, increased sweating, accelerated heart rate, decreased digestive function, increased adrenaline, bladder function decreased. And so this also goes to the same organs, but has the other effect. Slows heart rate, increased digestive function, contracts bladder. So we want to spend time in this healing area because we're already spending a lot of time there. Now we need to be able to enter this area and then get right back out. So what are some of the things you think that would put you in, and this is the same, this is more sympathetic, this is if the sympathetic activation gets too high for too long, and this is if this gets too low for too long. They have a similar effect. What do you think would put you in a high sympathetic state or high, let's go back to here, fight, flight, or freeze state?
What do you mean?
So, what makes you stressed out in a negative way? Physically, chemically, or mentally?
Physically, the pain.
Okay.
Mentally, the pain.
Yeah. So pain is definitely puts us in that, and that's not even it's not even our imagination anymore. That's experience. We're experiencing the suffering that we're supposed to be preparing for and supposed to respond to. So pain is one. So what's something else?
Stresses, external stresses, like you're walking and the dog comes up that's not on a leash and starts barking at you.
All right, dog not on a leash, barking at you. Okay, so kind of concerned about that, and that's an appropriate time to get into this state of mind and body and go, okay, I need to be ready to fight or to run or play possum. What do I need to do here? And so that's good. What about if either Trump or Harris become president?
Yeah, that's right. Yeah.
All right. So,
mental stressors.
Or right, or watching CNN or Fox, for 7 hours a day. Yes. Right. So these are things that put you in that state. Yeah. So what about breathing the Central Valley air, which is loaded with smoke and pesticides, right? So our life is unnaturally stressful. We're dealing with this all the time. So we have to go out of our way. This chemically, also the whole center of the grocery store, right? This stuff is designed to make us happy for the moment and diseased for the long haul. Chronic medication use. Ice cream? Yep. Yeah. Well, it's on the center where I'm thinking about.
Okay.
Right. All right. So now you distracted me.
Sorry.
So what was the other one? So anyway, we got the point. All right? So we want to spend time over here. How do we do that? There's multiple ways. So I'm a chiropractor, right? Chiropractic adjustments actually activate the parasympathetic nervous system immediately. We measure this before and after. It's pretty cool. But then you have to live a life that promotes that and maintains that as well. These are some of the symptoms that can develop. All kinds of things.
I don't see hair loss in there.
It's there. It's there.
I have a lot of it.
Okay. All right, let's tell another story. Ellen was dependent upon insulin, but she still had a love for life. Even medicated, her blood sugar was still not well under control. She came in with another elderly friend in similar circumstances, but was not over fat. Ellen was over fat. Her friend was not. And they got an offer from a doctor that advertised me. He's from Fresno. And he said, hey, we can fix you up. Just $10,000 each. And that's a special. It's usually $20,000 each. But since you're together, we'll give you a half price. So it was actually quite generous, but really expensive. So she decided not to do that, although she had already was planning to pay for it. She was ready to do it. And I said, I think we can do better. So we started an eating program. The changes that occurred in their bodies, both of them. Did I say how old they were? No, they were elderly, right?
Okay.
So they were like 80 years old. Right? So the spring chickens. The changes that occurred in their bodies from this weight, the weight loss, and blood sugar control were impressive and dramatically slowed the progression of the neuropathy, but it didn't reverse it. So we started with an eating program. And they were very disciplined. They did a really good job. In fact, both their doctors, one doctor of one of the ladies, he actually took her blood work and framed it on the wall. Because like nobody does this. And the other one said like 5 times, this is amazing. They had not entirely, but largely reversed their diabetic condition. It was pretty phenomenal, but it was super hard work. But it didn't reverse the neuropathy. So that's where I would have been before. Years ago, I was like, we can slow it or stop it, maybe, but we can't turn it around. We can't reverse it until I learned more. So peripheral neuropathy specific treatment we gave them. It continued her home therapy and office therapy for 15 weeks. After reevaluation, we found dramatically reduced numbness, and she can now sleep without pain. So for me, it's important we do these measurements before and after. Now, of course, with the patients, they're like, well, I feel better, and that's all I care. I was like, well, that's awesome, but that's not all I care. I want you to actually be more well than when we started. So, because there's a lot of ways you can feel better for a moment, but then you're actually getting worse. So people can be well medicated without being well. And so she had dramatically reduced numbness. And when we tested, she could feel things she wasn't able to feel before. She was now safer, and the nerves had regenerated. All right. So what are the causes of neuropathy? Because if we can figure out the cause, then we want to stop it, right? So there's trauma. So you can compress a nerve. So don't be traumatized anymore. Some of the things we can't do anything about, right? Repetitive stress, biomechanical pressure. This is very common. So it can be, posture. We'll talk about some posture and how it affects the nerves. That's pretty interesting. Chemical conditions, right? So repetitive stress. Diabetes, yes, it's very common. Nutritional vitamin imbalances, alcoholism, exposure to toxins, vascular issues, blood flow. Autoimmune, that's where your body attacks itself. Chemotherapy drugs for cancer, radiation therapy, infections, genetic, etc. What about this last one? Prescription medications for heart disease and blood pressure. Drugs used to treat high cholesterol, drugs used to fight cancer, drugs used to fight infections, drugs used to treat autoimmune disease. Wait, autoimmune is part of the cause, and you take this seems to be counterproductive. Drugs used to treat seizures, anti-alcohol, and fight HIV and AIDS. So you get a prescription. It's a prescription not for health, but for a long death. Not for a wellness, but you feel better, but you actually get worse. Now, not that all prescriptions are always bad, right? We just want to be aware these things can cause neuropathy. So, did you know this information?
Some of it.
Yeah.
Do a lot of research.
Good.
I was on statin.
Yeah.
And went off about 2 months ago.
Yeah. So, how long have you had these symptoms? You think about, okay, so how long have I had it? And how many doctors have you seen? Or how many websites have you looked on? And why weren't you told? Why weren't you told this information about the causes of neuropathy? And we've just barely touched on the solutions, but we're even hearing stories about people recovering or regenerating. Well, it's decades of consumers demanding quick fixes. It's like, wait, no, it's the doctor's fault. It's not my fault. It's not the doctor's fault. I mean, it kind of maybe is, right? But it's everybody driving doctors, moving doctors, pushing doctors into a certain so human nature and desire for not wasting time or effort. This is a good thing. We don't want to waste time or effort. Makes us think, I want all my healthcare to look like this: quick, easy, and cheap. Now that's not wrong to want that, right? I want that too: quicker, easier, and cheaper, and effective, and not having a side effect. I added a few things to it, right? But quick, easy, and cheap really is the main concerns people have. And drug companies say, well, we can meet your need if you'll pay us handsomely for it. So that's really what's driving the system. I don't blame pharmaceutical companies. I don't blame doctors. It's entirely. I think there should be more good education like we're doing here. But they're just going, okay, that's what you want. That's what I'll give you. You want something that requires no effort on your part? Just pop that pill. I'm here for you. And not, you're here because you want something different. But 9 out of 10 other people don't want to be here because I don't have the one pill that's going to fix their problems. So that's why most of the medical system is catering to that type of person. They're giving them what they want. So what's a doctor to do? I have some doctor friends, doctor patients that really want to help people the right way like I do, but they're in a system that they have a harder time doing that. So patients demand and pay for solutions that are quick, easy, and cheap. Pharmaceutical sales reps and research publications, and even the FDA approval and medical school costs are largely funded by drug companies. Yes, the FDA is funded, but do you know that the FDA is mostly funded by drug companies? The Food and Drug Administration. So this is not secret information. So they have an approval process, and it seems kind of smart on the surface is like, this is a good idea. So we don't want the government to take our money to do this stuff, right? So say, well, let's have pharmaceutical companies pay for all these doctors to research drugs and see if they're safe for the public, and to go through that approval process, which takes lots of money and time. Let's say let's make the pharmaceutical companies pay for that. It's like, that makes sense. Well, now you've got the people getting approved paying the people who do the approving. It's like, well, maybe that wasn't such a good idea after all. And it's like, well, now I wanted to approve really fast. Well, that's going to cost you more. But we're not saying you're going to be approved. We're just going to we're going to check it out really fast. And so in theory, that can be done ethically and honestly, but it's challenging when your paycheck is coming from indirectly from the people that you're saying yes or no to. So, all right. And the insurance companies and clinics demand cost cutting by seeing more people for shorter times. So what's the doctor to do? When the occasional patient comes in and wants natural solutions, they just aren't prepared for it. And so they say, well, you're fine until you have a disease that they can treat. Right? So come back in 6 months and we'll see how you're doing. It's like, oh, now you have a disease. Okay, now we can do something about it. Now we can ethically give you a drug or surgery to treat that. It's like, no. I want to get well. I don't want to get more disease. All right. So the last 5 to 10 years, think about the consequences. Have you had changes in your ability to go places, do things, or enjoy life? Strength, energy, focus, sleep, prescription side effects worsening. How are things going? And how will they go over the next 5 to 10 years if you do nothing for recovery or do just enough to feel good along the way? 25% of people with diabetes will develop a foot ulcer, and 90% of hospital admissions for diabetic foot ulcers are related to peripheral neuropathy and infection. That's kind of gross. All right, so let's tell a fun story now. So I had a friend who's on an airplane, and he was sitting next to a person that, maybe he needed 2 seats in the plane, but they just had one. And they were sharing these 3 seats, these 3 people. And so a friend sitting there kind of squished, giving this guy his 1 1/4 seats. And that guy's talking, and he's eating, he's drinking a soda and having a couple of granola bars that are loaded with sugar and stuff. And he's like, yeah. So they're on the plane, heading out and getting comfortable, chatty now. And the guy's like, yeah, finds out my friend's a doctor and says, oh yeah, I've got these health problems and yada, yada, yada. And, my family, they've got these health problems too. He's like, as he washes down his granola bar with the soda, and he's like, it just runs in my family. My friend looks over and he's like, the problem is nobody runs in your family. All right. So the way we think organizes our behaviors. So this guy was like, well, there's nothing I can do about it. So why not? Just enjoy the moment. Right? So our behaviors will predict our outcomes. So thinking organizes behaviors, and behaviors predict our outcomes. All right, so what are our options with less neuropathy? We talked about if neuropathy continues, what about if it goes away? So what if you had all your health back? What would you do differently? Because if you have a goal and you have, so the premise for our office, Synergy Chiropractic and Natural Health, is people under our care are healthier and safer than people not under our care. And our mission and vision is to restore hope and health for lifetime family wellness. It starts with hope. If you have hope, then you can start to take action. So I want to give you some hope. What would you do differently? You don't have to share this right now, but think about it. What would you do differently if you had your health back? I know. You'd go shopping with her. Yeah. And you guys would both have a good time, right? Okay.
Switch shoes.
Right. So, and what would you do that you can't do or don't do the way you want to do now? What would you do if you had your body back? If you could live the life you want to live. So, I love to hike. I don't have any grandkids yet, but it won't be too long. I'll have some grandkids. I've got a 19 and 22-year-old. Thanks. He just had lunch with him today.
Yeah, I just had lunch with him. And I told him, I was saying, and you're 21, I was 22. Oh, yeah, okay.
I corrected it.
All right. When you're that age, it's like
every year matters.
That's right. You want to be older.
That's right. Okay, so COVID. 61% of COVID-19 patients were seeking neuropathic pain treatments at follow-up. COVID may contribute to these neuropathy irritations. Diabetes, of course. 30 million people in the U.S. have diabetes. At least 50% of diabetic individuals will develop diabetic neuropathy. Super common cause. So we want to get that under control. If it takes medications, then so be it. But we definitely want to get diet really dialed in, be really disciplined with that, because that's important. There's things we can do to help regenerate, but we don't want to keep killing the nerve when we're trying to heal the nerve at the same time. And exercise and dietary changes are been shown to prevent and improve neuropathic pain. So just that alone can improve some of the sensations. It doesn't restore the nerves, but it can make you feel better a little bit. And that's a natural way to do it. And it is promoting the healing process. Okay, biomechanical alignment. These are some pretty cool research here. So loss of curvature. Change in the curve puts strain directly on the spinal cord and or existing spinal nerves. So you should have a normal curve in the neck from the side. Should go like this. In your upper back, it should go like this. And your lower back should have a curve like this. So a normal spinal alignment. Postural stress. Forward head posture increases pressure on nerves at the spinal level or from strained muscles in the neck. And malalignment. The vertebrae can misalign due to trauma or repetitive stress, causing direct or indirect pressure on spinal cord and exiting spinal nerves. And yeah, there's more complicated ways things happen. I won't go into all that, but as a chiropractic neurologist, it's not just a bone on a nerve, right? There's really fancy stuff with these nerve feedback to the brain, and the brain then controls the body. So that's a lot of that is lost when the joints don't move properly. So we'll talk a little bit about some of the research. So regardless of the type or cause of neuropathy, the nervous system interference or dysfunction will always limit healing and optimal function. So even if it's like, oh, it's diabetes, it's not a spinal problem. It's like, well, let's get the nervous system working as well as it can in every aspect, because we're already in the hole a little bit. We want to take every chance we can to get the nervous system working in every way that it can. All right, so this research from the Journal of Orthopedic and Sports Physical Therapy, better known as JOSP. Okay, so patients with mild or moderate carpal tunnel syndrome, right, that's that mononeuropathy, exhibited a greater forward head posture and less cervical range of motion as compared to healthy controls. Wow. This one from neuroquantology, neuroscience and quantum physics. That's pretty fancy. Forward head posture is strongly related to motor nerve conduction impairment in patients with carpal tunnel syndrome. Motor nerve, that's that last one it's damaged. It's one that controls muscles. You get muscle atrophy or weakness when those motor nerves. So in this case, it's related to neck affecting hand, but you can also imagine low back affecting legs or feet. Here's the cool part. We found that forward head posture had a significant deleterious or bad effect on nerve conductions. We found that forward head posture makes patients more prone to peripheral nerve entrapments and leads to upper extremity disabilities. This is from the Acta Neurologica Bellica. Okay.
I just thought of something. The forward head.
Uh-huh. Yeah. Kids on devices all the time, right? Parents, it used to be all kids. Like, well, now it's all of us, right, on devices. So, yeah. And 75% of high school kids have mild to moderate head forward posture. And that's not just taking pictures of them when they're on their devices. This is when, like, okay, stand up straight, let's take a picture, got it. 75% moderate to severe. So they're already dealing with these, and it affects brain function, it affects memory. In my spinal hygiene class, I teach about those things. But let's continue. Okay, so this is the cool, I think this is the cool part. Can't wait to get to, that was all bad news, right? but corrected program to improve forward head posture, decreased pain, and increased the function of the nerves traveling from the neck to the hands. We talked about all these causes. This is a solution. Correcting that forward head posture to now be more upright, improve the function. So it's one thing to say, oh, there's a correlation. This and this happen at the same time, but then go, okay, then you fix this and this goes away. It's like, well, now we're looking at probably a cause and effect. All right, spinal biomechanics, vertebral subluxation. Vertebral, that's the spinal bones, is a misalignment of the spinal column, which negatively affects nerve or neurological function. So this is the head upright. This is off to the side. There's blood vessels to go through. This is the spinal cord. 200 million neurons traveling from the brain down here and then out to the body. If that's not working right, that can be affected, and nerve function anywhere can be affected. Here's a case study from the Journal of Family Medicine and Primary Care. 55-year-old male with a history of progressively worsening tingling and numbness and radiating into the right shoulder and arm, 6 months duration. After 12 sessions of chiropractic care, the patient experienced complete alleviation from the radicular. That's not just ridiculous. That means pain down into the arm and hand. After 9-month follow-up, the radiographs revealed a restoration of the normal curve. That's pretty phenomenal. Somebody who has that much degeneration, that usually doesn't happen. But restoring, even just restoring the function can restore, even if you don't restore the curve, if you restore the proper movement of those spinal joints, then you can restore a lot of the nerve function as well. All right, so what's the impact of spinal hygiene on health if you take care of your spine the right way? So 80-year-old female, this is a patient of mine. She had constant alternating diarrhea and constipation. She wasn't able to care for her husband, who was even worse off than she was. Couldn't do her housework. So she went to the doctor. They gave her prescriptions. Said, okay, maybe this will make you feel better. It wasn't enough. So I said, okay, let's do an x-ray. Let's see what's going on. That didn't provide any solutions. Okay, let's do an MRI. Let's see what's really going on. Can't find any problem. There's no problem. You're fine. It's like, but I know you're not fine. This is a nice doctor. He's like, I know you're not making it up just because I can't find it. So I'm going to give you Vicodin so you feel better. There's nothing wrong, but I want to make you feel better. So she's not feeling better. She's feeling hopeless now. So she came to our office. We took an x-ray. She had this head forward posture, 46 millimeters head forward posture. She actually had pretty decent disc space. There's some degeneration, but not near as bad as most 80-year-olds. And this is her after. And you see the changes. It's pretty cool. So she's now more upright. And her bowel movements were much improved. She was able to cook and clean and no longer dependent on medication. So we talked earlier about the autonomic nervous system. That's the sympathetic and the parasympathetic, the stress and survival, the rest, digest, and heal. So we can measure that in our office, and we get a graph that looks much like this. Autonomic dysfunction can be evaluated measuring skin temperature differences. Skin temperature differences are associated with vertebral subluxations, a spinal problem. These values can be used as a standard to assess sympathetic, the stress and survival nervous system, and the degree of asymmetry or imbalance is a way to quantify or measure the amount of dysfunction. So pretty amazing. So this is a thermal scan of a 5-year-old boy who came in, and he had some, his mom called it seizing episodes. They weren't quite seizures, but he would lock up sometimes for minutes, sometimes all day long. He could still move, it just couldn't bend very well. So there's high intensity balances in the upper cervical. This area feeds into the brainstem area, which controls organs, spinal muscle tone, and attention. Really a whole profound effect there. And then a scan later, much improved. You can see that's now gone. Still not out of the woods, but much better. All right, another story. Middle-aged man, working professional. He loved to golf. That's kind of his deal. He asked if there was anything I could do to help him with neuropathy because he's getting worse and it might start interfering with his golf. It was already making walking and sleep uncomfortable. Problem is, he said, I'm kind of short on time. So I'm like, okay. So, well, we had a differential diagnosis. He was not diabetic. He had not had radiation treatment. He was not on medications that might cause it. As far as we could tell, he didn't have an autoimmune condition. Like, man, this guy's got nothing wrong, right? Some areas were already halfway to the dangerous high risk level sensory loss when we did our testing. So when it gets all the way to zero, the risk of infection and amputation raises dramatically. He understood the seriousness and said he was willing to make time if he could really make improvements. So we moved ahead with the treatment to promote healing in the nerves. And after only 1 month, our testing showed his sensation had already improved. He can now feel almost normally in areas where he could barely feel before. And that was amazing. And at first it was surprising, but I'm no longer surprised by it. I really have that as an expectation at this point. Okay, so what do we do when somebody comes in? What's the process? So we start with neuropathy-specific history and neuropathy severity and spinal screening. Talk about your symptoms. The sensory motor system for polyneuropathy, we do specific testing. Spinal motion palpation, we do the scans to detect the subluxations, the thermography and electromyography. Part 2, more structural and neurological testing, autonomic nervous system with heart rate variability, computerized balance evaluation if we think that's going to be helpful, postural, gait, digital foot analysis, and we do x-rays if needed. And the next step, if we move forward, is to do lab testing for deficiencies, leaky gut, toxicity, and more. So really check every angle of this. The office is called synergy because that's combining multiple things to get that exponential benefit. And it's also can be negative, the synergy of physical, chemical, mental, toxic, and all these things contributing to your condition. And it's like sitting on 3 tacks. If you remove one tack, you're like, well, that doesn't feel any better. Sometimes you have to remove all 3 tacks to really get the benefit. And that's why this synergistic approach is sometimes needed. And in peripheral neuropathy, it's almost always needed. All right, Mr. Castillo is 81 years old. Foot pain and numbness for 12 years and progressively worsening a week after his colonoscopy a few months ago. It's like, well, how does a colonoscopy? I don't know. Maybe it was the chemical effect. You have to swallow a bunch of stuff, and I'm not sure. So we had one person after surgery got a lot worse. One person after colonoscopy got a lot worse. And he was no longer motivated to get up and move, give up walking almost entirely. And his wife really loved to walk. She's like, come on. He's like, I don't want to. He was done. He's taking gabapentin, but he still had a 10 out of 10 burning electric-like pain at times. So in less than 3 months into treatment, we've seen a 50% improvement in nerve function healing. His wife says, I got my husband back. He's joining me on walks again. He's willing to go to social events again. And I didn't know that before. I like to get people's stories and stuff, but he's kind of a quiet man. And so we learned that afterwards, mostly from his wife. Mm-hmm. She's like, you got him back. He'll go to social stuff. I'm like, you wouldn't go out to social stuff? Was it the discomfort of walking? I'm not sure exactly, but he's like, just lost motivation to interact. So that's our last story. So I have one more. Yeah, I have one more story though. So picture with me a zebra, and there's a mama zebra and a baby zebra, and the mama just gave birth to the baby zebra, and the baby's laying there, fresh born, just trying to breathe and relax. And mama says, you got to get up and run. And the baby's like, you got to be kidding me. Like, I just want to lay here. And you know how hard it is to get born? Like, don't I know? So so the mom's like, no, really, you got to get up. You got to run. And the baby's like, but the grass is so green and the sky is so blue. It's like, you have to? He's like, baby, the lions are coming. You got to get up and run. The same thing's true for us. So the lions are coming, and that's our lack of health. This is a progressive degenerative problem. It's not going to get better on its own. It's not going to get better with medication that makes you feel better. So the lions are coming, and really now is the time to take action. Thank you for joining me. So I am going to offer something. So usually our peripheral neuropathy evaluation is $375 for people at the workshop, or if you guys call in or text in, comment in from the I'll have you call. So our phone number is 559-635-8266. You guys are here, so you don't have to call. But I'll do an evaluation for $145 instead of $375 because we just want to know if you've got a problem that we can help with. And that's our evaluation helps us know that. And for the people who take action, those are obviously the people that I can help. If you know somebody else who wants that as well, then for the next 7 days, I'll make that available to them as well. So we'll do that for 7 days. So this day next week. You guys have any questions? A lot of information, huh? So Anna, can you see anybody online at this point? Okay. Do you have any questions online? Anna's gonna ask your question if you have one. So why don't you give us a thumbs up if you can hear us well online? The last session we did, there was no volume.
Oh.
Or it was like really far away volume. They might be going to the bathroom or getting a snack right now. Okay, so you guys are excused, but you can stick around. I'll stick around and answer any questions you guys have. All right. Thanks.
All right. Thank you.
And if you want to make an appointment, then Anna can make that for you right now.
I have one.
Oh yeah. And what we'll do for you, we'll discount it to this offer.
Okay.
Okay.
And I have this.
Great. Yeah, you can give that to Anna and we'll check that out. All right, I'm going to sign off here. Goodbye.
Mm-hmm.